All right, good morning, good morning, good morning. Just going back to where we left off at yesterday and where we're picking up today. All right, as we look at your primary, secondary, and tertiary lesions, yesterday we took a look at a few things that flowed from blisters to nodules to cysts. Okay, so we looked at blisters to nodules and cysts yesterday as just a small description. You knowing exactly what it is, okay? Before you're touching a client, be found in the scalp, on the face, on the arm, on the leg, um, all of them within scope of practices for cosmetology and estheticians. And so when you see something, please make sure you say something. We need to always keep in mind what does normacy look like, and anything outside of that is going to be a red flag. Okay, it's going to be an opportunity for us to pause and think about the contraindication. That's a term that we've introduced. And I said, whenever there's a doubt, we need to really consider the contraindications. Okay, what happened if I continue the service with these red flags that I see? What's the possibility? A lot of times, the next chapter we're looking at skin analysis. Okay, so and that is going to incorporate consultation. It's also going to incorporate us using our eyes and the actual skin and hair analysis. Okay, well, during the consultation component, there are also release forms that the client must sign. When the client signs the release form saying that they have informed you of everything, they've checked all the boxes that pertain to them, if the client is leaving out something and then you proceed with a service and there's something, that happens that wasn't supposed to happen, by them not telling you the truth, it could be a cause for really something drastic to happen that could take months of recuperation. Okay. If they have told the truth, signed off on everything, even though release form, and you knew in your professional knowledge that you weren't supposed to do something, that opens you up liable for accountability. And so, however way that goes with this lawsuit or whatever, you're liable because in that instance, you were considered the expert and you received monies in exchange for service. So, in exchange for service, as the service provider, you're supposed to be the expert. Okay. And so, sometimes the license is the one thing that holds you accountable. Those individuals that make these mistakes all the time, that have no license, they have to take it up into civil court. But it's usually on the person that allowed them to perform the service because they knew they didn't have the license, or they went to an unlicensed professional. So when they do go to a licensed professional and we bypass these things and continue to perform the services, it holds us liable. So we're the good part of the industry and we get the other part of it. We have to make sound decisions. This is why every bump you see, you don't go picking at it. This is why you don't wax everything that people want you to see. This is why you don't do a chemical peel on people you don't even know. You've never built a relationship with them. You don't know they walk through the door and talking about they want a chemical peel. No, we're not doing that. Okay. Most of the time, you're trained in your chemical peels, and it's a prep season, a prep time for the skin before you even put things on. Have you guys seen the guy on TikTok who put TCA, Dr. Jasmine, this is a very strong peel on his face? He had beautiful skin before he did it. And you see his skin is still recuperating. When I saw the pink spots on his skin, I knew that he would have some hyperpigmentation and some burning. So when his skin was peeling, it was these larger pink areas. That's burning. He literally burnt his skin with the chemical peel, the acid and chemical and a chemical peel. Sometimes they call it an acid peel. I think you find it in most textbooks as acid peel. Think about acid. Um, think about the acid that's in the coat, but also think about if you was to take some lemon, think about acid battery. Okay, so think about that's on all of that is on the same end of the pH. But he put that acid peel on his face. It was very strong. And as his skin peeled like it was supposed to, but it was burnt. It was burnt. And I saw the pinkness and the spots. And as he continued to heal, I'm looking at just different parts of the journey. I can see that before he put it on, he looked better than the results that he got. So now he got a couple of months of trying to get all of the get an even skin tone back and continuously healing in those particular areas. I would say a month, 6 months to a year, period. So sometimes people do things for the gram. They do things for TikTok and views, and it's always not the best things. Okay, it's not the best things. So when you see things like cysts, and all of these, when you see all of these, it should be light bulbs that are coming, going off. Um, cysts is outside of your range. You must refer them to a medical professional. So thinking you're a doctor pimple popper, and when you're an esthetician or when you're a cosmetologist is outlandish. Okay, we cannot burst everything, we cannot pop everything. You can't just stick a pin in it, because as soon as you open that, when you break the skin, remember the skin is a protector. You open it up to possible infection. So we don't want to break the skin at all. And even if you're going to do extractions and remove the pus out of a pimple, remove the blackheads and whiteheads, there's a protocol on how to do that. And many individuals who are not trained do not know. They just do what they want to do, which causes even more issues. There's a condition called HS. I don't know if many individuals know about it, but HS a lot of times can be in the underarms and intimate areas. And many individuals will say, hey, they want to get waxing, they want to get sugaring, or just open up shop after going through a 1-day certification and get a certificate for waxing. And I see this all the time. Using high frequency lights, so much stuff is going on. They cause more problems than what they solve. And so any HS outbreaks is going to be some similar to like boil, and the skin is going to be kind of soft, and then you could possibly have ruptures, and it will kind of be impossible. It's a very high case that you would not be able to do any waxing, because it would be in certain areas, and it's impossible sometimes to spread wax and not damage the skin. So you have some individuals that like to opt for sugaring, or they opt for lasering. Again, that is at a higher standard than what our scope of practice covers. And so we got to get a hold on people doing intrusive things without proper licensure or education. So when you see these things, bulla, cyst, mosio, nodule, the knots, the papule, the pustules, tumors, vesicules, and wales, it needs to be what form of lesion is this? Okay. And how do we recommend? Who do we send the recommendation to? What do we tell our clients? Okay. So all of these, when you see them, please say something. And sometimes your client wouldn't even know that they're there. So if you see a tumor, it's like, oh, we went over that in school, don't know a whole lot about it. It really is an indication of cancer. And then you can go look on your client's form. Your client never marked that they may have had an indication of cancer. You may be the first one to see it. You got to take a picture. You must say something and tell them to go get it checked out, because that's something you're not able to do. You need to find out what that is, what that mass is, before you perform a service on them, or especially any chemicals. Let's talk about the oil glands and sweat glands. I feel like we've talked about this for a while. Of course, it feels like repeated information, but oil glands are sebaceous glands. Sweat glands are pseudoflorous glands. They're both connected to the hair follicle. Okay, they excrete uh, oil and sweat into the follicle, comes up to the pore, sits on the scalp as an acid mantle. It sits all over the skin as an acid mantle. And that keeps our skin balanced, our pH balanced. There are disorders of the oil gland and also disorders of the sweat gland. So, right? Disorders of the oil gland. We see this all the time. I know you guys have seen blackheads and whiteheads, okay? You can look at a person's nose, cheeks, forehead, back of the neck. You would not know that blackheads can really set in the back of the neck. A story one of my students had, he was a male student, but he had this big, thick herringbone chain. It was silver, and I think he had it on for a long time. Well, the chain was whatever the metal was supposed to be, but the clasps was not. Okay, so the clasps were not, and it accumulated oil and dirt around his neck. And when they got ready to do facials, a back treatment, my student noticed that he had a big black, she said mold. But as we began to put cleanser and things, it softened their skin. And I pulled the skin and it came away from what they said the mold. I said, that is not a mold. That is a giant blackhead. And so basically, a pore assumed oil and dirt from the placement of that necklace. It just stayed in place all the time. So it trapped that oil and dirt. And this person probably did not wash their neck as much as they should have. But oil and dirt was trapped. And here's the thing, your pores will make room for the oil and dirt if you do not remove it. Your pores, they are almost, it should be microscopic. You should not be looking at a person and see enlarged pores. When you do see that, that is an indication that maybe the sebaceous glands is kind of out of whack, that they're producing more oil, because the more oil that is produced, it has to have somewhere to go. So that pore just starts to enlarge. Okay. And you guys know it because you may say craters, or someone had like some craters, or they had indentions, or I can really see their pores are enlarged on their cheeks. You see that. Okay. And so when I see that, just visually, that tells me that maybe somebody's oil glands are overworking themselves and it's producing too much oil. And because it's producing too much oil, the pore is starting to expand. Okay. Which means it will make room for all the bad stuff that you want to get out if you don't get it out like you're supposed to. Okay. It will start to make room. So we had to do an extraction, and it looked like a big hole, not a huge one, but it was a big hole in his neck. And what happened, it would eventually shrink back up, get tight, but you don't need to let it stay in there a long period of time. I had a young lady thought she had a mold on her forehead. It was not a mold on her forehead. It was a giant blackhead. Okay. Just was always sweating on the forehead, never really adequately did a facial, never had a facial, never had anyone to pay attention to it. It just kept growing and growing and growing. And the pore started to expand itself to just receive it. Anytime you're doing a blackhead and then you have a blackhead and you're trying to clean that pore out. If it is black and brown, it's been there a long time. Okay. If it is white or yellow, hey, good timing. Hadn't been there a long time. Ain't had time to really chill. That's what you want. Okay. So first, we have comedones. Comedones is the technical term for blackhead and whitehead. Okay, comedone. Comedones, they come in closed blackhead, closed comedone, and open comedone. Okay, so a comedone is just a buildup of oil, sweat, and dirt. That's a comedone. And sometimes you'll see, like, man, I don't see anything come to the surface, but I know something is there. Okay, it may be underneath and hadn't come up to the surface yet. Says an open comedone, also known as a blackhead, is a hair follicle filled with keratin and sebum. Okay. When the sebum, the oil, comes to the surface of the skin and is exposed to air, it's called oxidizing. The longer it's there, the blacker it gets. Okay. Comedones appear more frequently on the face, but can you have blackheads in other areas? Can you have blackheads and whiteheads in other areas? Yes. When people do bikini waxing, Brazilian waxing, they now have a service called like a vajacial or a manjacial, where it's a deep cleansing of an intimate area. Most times, if individuals do razoring and things like that at home, their hair just kind of grows a certain way. They may have ingrown hair, so the esthetician or cosmetologist would need to, remove the ingrown hairs. In removing that, you'll find also that there's comedones in those areas where sebum, oil, sweat, and dirt has just built up, and you find that individuals will have it in those areas too. Wherever there's hair, it's a possibility, accumulation of hair, to have comedones. So yes, you can have them under your arm. Yes, you can have them on your scalp. Okay, but primarily you find them on the face. Many individuals, when you look at on the face, the cheeks, the nose, okay, the chin, those are areas where you'll find blackheads. All right, especially in the T-zone. Now, the T-zone is the forehead, and then you come back between the eyes, the nose, and the lips. Okay, that particular area, in some cases, are usually the oiliest part of the face. So this is where we will find most of that accumulation. Okay, this is where we'll find most of that accumulation. Here's someone that has a lot of impaction on the side of the eye. This area needs a good cleansing, good steaming, good soft towel. Okay. I would even probably put a dry mask, like a drying mask over it, just to kind of pull it up to the surface, because the mask is going to tighten and pull up. Once I remove that mask, I go back in with some extractions to remove all these dark spots. Okay. All these dark spots. Closed comedone is known as a whitehead. Okay. The sebum is up to the surface. It just not has been there a long period of time. It's fresh. You can remove it, skin go back to tightening up without a period of time. Okay. You have to be very, very careful on the removal of extraction and doing extractions. Okay. Some people say it's part of the facial. Some people say it is not. It can be time consuming. So if you're a perfectionist, I would not put extractions in your basic service. I would use extractions as an add-on service. Most of the time, people do $1 a minute when it comes to extractions, but you could do whatever you want to do. You can include it in your facials, but the rule is not to spend more than 5 minutes on extractions, because you can make the skin kind of turn on you. It's allowing you to do the extractions, but it can only take so much, like pain or restriction at one time. So the pain may be at a level where the client could not just, let you finish. So 5 minutes at a time, just so the skin could breathe, do the mask, and then come back and do another 5 minutes. That's usually what I do if I have to have a lot. Okay. Milia Most of the time we feel milia, it is mainly compactions underneath the skin. It's not come up to the surface, does not have an opening. This is where most of the time you may see a dermatologist take a needle and just kind of stick it in the compacted area, and then all the white sebum debris comes out. Milia sometimes is felt underneath the skin, mostly where you will find this at. If you look at your chin, take your lips and then look at your chin, you won't see like the open compactions, the open comedones where it can come to the surface, but you feel it, okay? And so that's a treatment area that a lot of individuals, especially men, gotta deal with. Like you have this debris underneath the skin. If you do not bring it to the surface and pull it out, it is gonna cause problems later on. Okay, so it's gonna be a breeding ground for acne. So you gotta make sure you get it out. And many individuals, they do their face and cheeks. They don't worry about their chin area under right there, that little area underneath the lip. And you should be worried about it. Okay. Especially those girlies who suffer from PCOS, PMOS. We have hair growth in different areas. Skin texture starts to change. And so it's a lot of things we need to look at. And so we would not neglect those little bitty areas. That's called milia. Okay. It's harmless. It's tiny pockets. It's near the skin surface. It's good for them to come out. They say they see it in a lot of babies. Okay. For my esthetician ladies, there's something called a lancet. A lancet is like a little small, sharp, like knife. But it's an instrument that estheticians use to kind of cut off hard, dead papules, um, or skin that has protruded and is dead. It doesn't have any life in it. And so you have to check with your state board. Tennessee says that we cannot cut or touch any live layers underneath the skin. So with you using your lance, and you got to make sure someone says, "Oh, I had this for a minute. It's a bump. It's hard. It just won't go away. It's just hard." And if it's really, really hard and there's no life in it, there's no blood getting to it, it's gonna start to turn dark. It's just sitting there. Within the advanced scope of aesthetics, with I would say med spa, and dermatologist, you're able to lance that off. Okay. Don't get that confused with moles. There you can remove moles, because for some reason barbers think that they can do mole removal in the barbershop, and that is not true. Okay, so we don't want to do anything like that. That's philia, and here we go here. One thing that can help get rid of milia, what we need to do, all of this needs to be softened. We need to soften this. And we will mainly soften it with something called galvanic treatment. Okay, galvanic treatment. The galvanic treatment will, you can take baking soda and water, what it's called disincrustation. Take baking soda and water, and I will brush that or pat that baking soda and water across here. Then I will use a galvanic frequency. Go across here, it will start to liquefy this underneath, and then when you do press it, it'll come up like water. Okay, so there's a will, there's a way. Okay, that is something that was used kind of back in the day, that would take, they said give us 30 days, but now we have enzymes and chemical pills that say give us 3 to 7 days. Okay, and so yeah, and how the chemical pills will work, it will start to soften and almost like a melting process. So it just depends how much money you want to provide for the service, Do you want to offer that service, or you can go old school? Okay. Let's look at these different grades of acne. Acne simplex, skin disorder characterized by chronic inflammation. I think we all have known someone that deals with acne, but acne has to be something great for you to understand, you to study. You may say, I got my license as a cosmetologist, but I like treating acne. Guess what? You can do that because as a cosmetologist, you can either choose to go into hair, skin, or nails, or all of them. As an esthetician, you may say, hey, I love doing everything else, but I want to specialize in acne treatment. Great. You will never be broke a day in your life because acne is a problem for a lot of people. And if you can find a solution, or you have the solution for them, whether it's product, service, education, consultation, you'll always have money. You'll always have a client. Okay. So, and our assignment tonight is going to reflect a lot about acne. So again, okay, epinoid cyst. This is a sebaceous cyst, and so it's filled with oil and keratin protein. Okay, you frequently see this on the scalp, okay, and back, and maybe surgically removed by a dermatologist. When you see this cosmetologist, please make sure you say something. You can feel it, okay? Don't think you can just style over it. We should not be doing any chemical relaxers or anything. A rare dermatitis is a skin condition, chronic inflammation of the sebaceous gland. So you're like, the sebaceous gland is oil. So you mean to tell me there's a chronic inflammation? Yes. Okay. Redness, drying, oily scaling. So that means as you shed the skin, sometimes it may be dry and sometimes it may be oily. Okay, but more than likely it's going to be oily. Stubborn dandruff, which means it won't go anywhere. Crusting and or itchiness. Okay, it can get irritating. You want to hold styles up long. The red flaky skin often appears in the eyebrows, can have very sensitivity, the beard, the scalp, the hairline, the middle of the forehead, and sides of the nose. It is not contagious. Okay. The skin cells just has a function that's kind of off the bar. Okay. You could possibly have an immune deficiency. Okay. And so, especially think about it, this particular client is always kind of sickly. This may be something that they would have as a side effect. Lipophilic yeast, sebum, that's oil compactions. But this particular client, anything that's drying, it has to be cleansing, then drying is, to me, is going to pull this oil accumulation up off the skin. And we got to remember, if we're going to use, we still got to put something on the skin to lubricate it. Most medications that you can use for the body, oils and creams, you cannot use for the face. So when it comes to the face, we got to make sure we find something that does not have those high numbers of oil compaction. Okay, we got to make sure we're using low oil compaction, such as shea butter, oil, argan oil, I think sunflower, avocado oil. All of those are small, compact. It does not cause a difference in the skin, and it does not cause you to have blackheads and whiteheads like oil buildup. Rosacea, the keyword is sensitivity and redness. Okay. Another keyword, inflammation. Okay. Inflammation. A person that has rosacea and you're performing a service on them, you will need to consistently treat the skin. When I say treat the skin, calm the skin down as you work. So you're going to need a lot of rose toner. Okay. Why do I say rose toner? Rose toner is very calming to the skin. I use it in waxing, and I also use it in the facial. I don't buy rose toner, I make my own. Okay. It does not last long if you do not use a preservative. But do your, do your homework. If you're gonna make a rose toner at home, get you some roses. And this is two ways. One, get you some roses. Make sure you clean those roses. Clean those petals. Pull the petals apart and clean them like you're washing greens and cabbage. Okay. You're gonna really clean those rose petals. All right. You're gonna put them in the pot, but the water is going to be distilled water. You cannot use spring water, and you should not use the water from the fountain. All right. The water makes a difference. You're gonna use distilled water. All right. And you're gonna let it boil. What happens, the heat is going to pull the nutrients out of the rose petal into the water. So the water is like an infusion. The roses will infuse the water with all its good properties. Okay. Rose water is also used in pedicures for dry, crusty, heels and things of that nature. So hey, rose water has some great benefits. Once it's also going to receive the color. So when you drain it, you're going to have this pink, reddish, and people buy with their eye, they eat with their eyes. So it's going to be a pretty red or pink water, and that is going to be your rose toner. I would say it would be good between 24 to 48 hours. Between 24 and 48 hours. People try to put it in the refrigerator, but remember, it's distilled water. It's not going to turn dark, but it could mold. All right. It's not going to turn dark, but it could mold, and you don't want to spray molded product on a client. What happens if you use fountain water or another type of water? The water will get black. It'll turn black because the minerals that are in the water, and then you have the red color. All right. That tells you that the water when what we think it is anyway. And nobody is going to buy black water. Well, I ain't gonna say nobody. Okay, depending on how you sell it. You sell water to a rainforest. I don't know, but it's not pleasingly aesthetic. Convincing someone that this black water is going to work on their face. Okay, and then I'm trying to remove mineral buildup. I'm not trying to add mineral buildup to the skin, so I wouldn't use the black water. I wouldn't use it at all. The other way that you would make rose water, I would find rose essential oil, distilled water, and find some aloe vera. Bam, I got a rose water. You think about that the next time you go in the store and you start purchasing rose water off the shelf. Yeah, I can make it, I can make it myself. Of course, if you want longevity of it, you will have to just look up recipes to make your rose water and then add your preservative that makes the shelf life last longer. The product does not become spoiled or moldy. Okay, it tells you how long. And so basically what I'm saying, when you see rosacea, you need to go straight to all your sensitivity products, all your sensitive skin stuff. Rosacea has to be calmed as you go. So you won't be able to do 2 or 3 steps of a facial or makeup service without calming the skin. You'll never use dirty brushes on this person. This person should stay out of the sun and heat. They should stay out of cold weather. Okay. They should reduce stress, because if they're stressed, you're going to see it all over their face. Okay. This person should not be eating Takis or any kind of spicy foods, because it's a trigger. They should not be eating or drinking caffeine. Okay. So we need to reduce the caffeine, the energy drinks, and alcohol. All of it plays a part in agitating this. Okay. They become triggers to the inflammation, triggers to rosacea. So We want to make sure you're using the lightest products, really a no fragrance based product, the most gentle products that you can find. It may be an additional cost because this is a skin issue. It's not a normal skin issue. So you're having to have more brain power, more money for products, and more time for the service. So it's going to take a little bit more than the average. Okay. So when we look at, I call it Tetesta. It is not the term. It is not the term, but we do call it Tetesta. When we look at Tetesta, we look at the inflammation. It initially from far off looks inflamed, but no, that's the capillaries coming to this almost to the surface. You can see them. Okay. You have to be very careful because we do have blood flow that goes in and out. So your pressure becomes a real issue. The pressure you're using on someone's face, their legs, their arms, wherever you may see this at. It could be hereditary, but come up in cold and heat as well. When someone's going through hormonal changes, you may start to see this as well. It is a red flag for you to just be cautious on your pressure. On those pressure points, be cautious. Let's look at pseudoflorus glands and abnormalities with that. We notice with sweat glands, you have issues with individuals that say they don't sweat. Then individuals say they sweat too much. Okay. All right. Anhidrosis, deficiency in perspiration, or the inability to sweat. Okay. Inability to sweat. It is life-threatening and requires medical attention. If someone tells you they don't sweat, that's a bad thing because your body sweats to kind of calm the body down before it goes into like a heat stroke shock. All right. So you need, when the body get overheated, you need to sweat because it calms the body down. Also, sweat is a part of the one thing that balances the pH of the body. So we not having sweat, and sweat also, we not having sweat is a major issue. Our body skin would not be pH balanced, which means that goes along with protecting our skin from other things that come in, keeps our skin strong and things of that nature. And if we don't have that, now we're starting to open the barriers for different things to be attached to us. Also, with the lack or inability to sweat, remember sweat pushes out toxins. So our toxins could really just be sitting there, just overspin. What was supposed to come out through the pores are not coming out through the pores. It's not hopping on the train. Okay. All right. And so you're going to see different types of hydrosis, bromhidrosis, foul smelling sweat. I mean, the sweat just smell like you worked outside 20 hours. Okay. Noticeable in the armpits, the feet, caused by bacteria. These individuals need to seek a professional. Okay. Severe cases require a medical professional. You have some treatments, individuals that do get Botox, they do turn to Botox treatments to help with this foul smell. Okay. But most of the time, this individual can't help it. It's a disorder of the sweat glands that can't help it. But they need to have, they can take as many showers and baths as possible. Okay. But when they sweat, it smells really, really bad. So they will need to seek a medical professional. Hyperhidrosis, excessive sweating caused by heat. Okay, genetics, stress, medications, or general body weakness requires a medical diagnosis and treatment. Okay, so this person has excessive, when they sweat bad. When you have individuals that I can't keep a silk out, I can't go outside, I'm gonna just sweat really, really bad. They sweat really bad, okay? Or they go through a stressful situation, they just start sweating. Medications would do it, or just the body being weak, okay, will do it as well. This person must see medical professional as well. Okay. For MR, also known as prickly heat, acute inflammatory disorder, that's those three words you really don't want to hear. AID. Okay. It's a disorder of the sweat glands characterized by the eruption of small red vesicles. These are like little bitty blisters accompanied by burning, itching skin. Okay. So, anybody ever heard of heat rash? Okay. Then itching. Okay. Then blisters, little bitty blisters. All right. And it could cause pain and it feels like your skin is burning. This also can happen when someone has sunburn. Okay. Skin inflammations is one thing I need you to know. The key word is inflammation. And how does inflammation look? Most of the time, inflammation means something has a spark of pain and it's red. A spark of pain and it's red. Some individuals say feels like my face is burning. Your face is inflamed. Okay. Anything that's hot needs cool. So in this case, if I'm dealing with clients that have inflamed scalp after a relaxer, redness of the scalp after a relaxer, I'm going to apply cool water or a cool towel or some ice cubes. Cool. First thing I need to do is calm the skin down. Once I calm the skin down, I can then go to plan B and start treating whatever's going on. If it is for the face, I'm red. I can't go through. Every time the esthetician touch my skin, it just burns, it's inflamed more. I'm gonna first calm the skin down. Okay, so I'm gonna use cold stones. I'm gonna use a cold towel, also ice cubes. I may spray rose toner on it. Okay, because rose toner is anti-inflammatory. It's gonna calm it down. Tea tree oil, lavender oil are both anti-inflammatory, which means they do the calming down of the skin. Okay, so I already told you what inflammation looks like. Very uncomfortable, redness, irritating, and harmful. Dermatitis, okay, inflammatory skin condition. Various forms include lesions such as eczema, vesicles, so little blisters, and papules. These are larger pimples. Okay, dermatitis. Okay, eczema falls into dermatitis, right? Eczema falls into dermatitis. Let's not forget that. When you're dealing with eczema, uncomfortable inflammatory skin disease that is often chronic. Okay, I didn't get eczema until I turned 30. I didn't know what was going on, but the back of my knees, the creases of my arms used to be really bad. Now I can tell a little bit behind my ear. I do have a component that comes up like on my face, around my chin area. Um, I don't know if that's monthly or what. I just go back and look at it. I do have my own thing I do to kind of treat eczema, but mine sparks during stress. I don't know if anybody else sparks during stress. It's not contagious, but I do holistic things like take a bath with oatmeal, um, add some goat milk powder to the bath, so like a milk bath. Um, get me some chamomile, the flour, grind it up, and give me a little oil, like a little argan oil, and mix it together. And if the kids are outside, I will oil them down. My nieces, I used to oil her down with that chamomile and that chamomile oil that I made. And that chamomile helps calm the skin from eczema, wasn't there any kind of itchiness that goes on, and it works for eczema as well. She had eczema on the eyelid around the orbital area. We look at skin infections. Y'all, skin infections, we can't service the client. Conjunctivitis, which is the pink eye, we can't service the clients. Clients cannot get any lashes. We can't do really anything around the eye. Okay. The skin infection, it is highly contagious. So your client said, just do my brows. You ain't got to do the lashes, do my brows. It's still contagious. Close enough. Okay. Close enough, and I could take it home to my family. Now, all my family got pink eye. Okay. Um, the medications over the counter are kind of mild. I would still say go and see a physician. Okay. When we look at bacterial skin infections, we see these little pustular patches. Okay. They can come up at any age. Sometimes we call it weeping skin, where the skin just kind of blisters out. Okay. In Portugal, I have had that. I think I had that. I'm for sure. It went away, but I had that like around 8 to 10. For us, it was stress. My mom said it was stress. I lost my dad around that time. It was just trauma, and I would have that on my legs. Um, Herpes simplex 1. Okay. We're all familiar with herpes simplex 1, fever, blister, or cold sore. Okay. Many people have no symptoms that they have it within their body, but fever, blister, and cold sores tend to be those symptoms that on the outward end that you know that you have herpes simplex 1. You're looking at about lips, nostrils, other parts of the body, sores that can last up to 3 weeks. Herpes simplex 2, caused by the same virus, and occurs below the waist. All right, so herpes simplex 2 and herpes simplex 1 are two different things. And we're going to be working with our clients, okay? And remember, this falls under skin infections. In the areas where you see herpes simplex 1, you're not going to be able to service them. So no lip waxes, no lip plumping, no lashes, no brows. I'm not going to be, that outbreak has to settle down before we can perform services. So no makeup, because again, that one can get in my brushes and be transferred from person to person. Okay. It is highly contagious and requires a medical professional. So on your consultation form, you can have herpes simplex. A client could hit it, could mark it, yeah, I have it, but you don't know which one. All right, so you need to put 1 and you need to put 2. And remember, 2 is found below the waist. So most of the time, 2, same virus, but mostly it's sexually transmitted. Okay, 1 is cold sore, or what you'll see, fever, blisters, and things of that nature. Not to say I'm not an expert in it, but as a business professional and also a beauty professional, we must be able to know the difference between the two. No, we're not servicing them, okay? But we need to be able to educate the clients between the two. Skin hypertrophies, whenever I hear hypertrophies, I'm definitely thinking of more, a lot. So it's an irregular growth, and a trophy, we mostly see atrophies in nail when we talk about the nails, okay? Where the nail grows over, it's growing too high. Those are trophies. So irregular growth of the skin. All right, mostly harmless, benign. This is where you see moles, skin tags, keloids, okay? Moles, skin tags, keloids are skin hypertrophies. This skin tag, this is what I'm saying. Barbers think that they could take off. No, must be removed by a dermatologist, not a barber. Okay. Psoriasis, skin disease characterized by red patches. Psoriasis for me is worse than dandruff, worse than eczema, worse than all this all put together. Right? Because it can be redness, irritating. If you pick it, it could cause scarring. So you almost just gotta like deal with it. Okay. Um, Barusa. This is a hypertrophy. Okay. Can spread from one location to another. Be very careful. Also known as warts. Okay. Warts can spread from one person to another, okay? Do not treat moles or remove hair from moles. Removing a hair from a mole could irritate or cause a structural change to happen, which means could grow, okay? So leave it be, send it to a dermatologist. Remember, we don't do that in our barbershops and salons. When we look at pigmented disorder, now we're looking at melanin, okay? Hyperpigmentation is a word you guys need to learn, and hypopigmentation is a word you need to learn. Hyperpigmentation means a lot of pigment, okay? A lot of pigment, overproduction of pigment. Our pigment cells, the melanocytes, they're giving up too much melanin, okay? This can happen in certain areas of the body, or on the face, on the back, okay? On the chest, the neck, whatever. Hyperpigmentation. Let me tell you, acne and hyperpigmentation are your 1 and 1 or your 1 and 2. People want clear, smooth skin. They want to know, why do I have these dark spots? Y'all, that's hyperpigmentation, it's dark spots. Then at the end, you got people saying, why do I have these light spots? Why is my skin picking up these little light, separating itself? That's hypopigmentation. We see this a lot in the summertime, because most time in the summertime, we neglect to take care of our skin the way that we've been doing it all year long. Okay, we go out in the sun, that melanin gets produced, but also we have melanin produced in other areas. Hypopigmentation, we have where the separation of melanin. Now we got white spots, okay? Most of the time, we see this in kids swimming without sun protection, okay? We see this in as a result from pools having too much cleaning products in them, or not enough cleaning products in them. So it could be on the high or the low end. We see this all the time, irregular pigmentation. And when I tell you, people pay for to get rid of hyperpigmentation, it is a billion-dollar business, because people have products, and the products say, and they have claims of evening skin tone, getting rid of dark spots. Well, if you remember, maybe a week or two ago, I told you or taught you that melanin is found on the deepest layer of the skin. So if you have a product, you buy it off the shelf, over the counter, that says helps with dark spots, and you just put it on the skin twice a day and leaving it there, y'all, it's not going anywhere. You got to have a product that's going to streamline and go straight through those layers of skin, go straight to where that melanin is balled up, to break that melanin up. Once that melanin is broken up, it starts to go back to the way it was. Everybody go back to its counter, its corner. Everybody move and go back to its corner. Okay? And so a lot of times, some people may say, Ms. Cox, what are you saying? Half the stuff, y'all, 75% of the stuff you buy over the counter is not working. It doesn't have enough power to do what you want it to do. And I encourage you to either experiment and make your own stuff, or buy holistically, where the product has more of a punch, okay? Because if it's over the counter, they're gonna put the minimum amount needed, and you need way more than that to really make a difference. And you may see a little change, but when you stop using it, you'll see most of the time things revert back to the way they were. Okay, so learning those terms, hyper versus hypo. All right, hyper versus hypo pigmentation. One is dark spots, one is light spots. Okay, it talks about hyperpigmentation, how it appears in different areas from aging. Okay, individuals who are Black and brown have mostly hyperpigmentation issues. Freckles are mostly found in skin types 1, 2. Those individuals that may say, hey, I'm from Ireland, or may have a background of European culture, you see a whole lot of freckles, and red hair and blue eyes. Now, have I seen people of color with freckles? Absolutely. Okay, that just means to me DNA is mixed, and there is such thing such as mixed melanin as well, where after a while the whole world would be a melting pot. Melasma is what I wanted you to really learn about. Okay, melasma. This is more recent information. This book may be 4 years old. It's the latest book for aesthetics and cosmetology. All of it is 4 years old. But when you look at melasma, melasma is just reaching maybe about a 10 year of research. Okay, so it's very, very new. New information is coming every day. And I'm quite sure since this book was written, there's more information that has been developed on melasma, okay, about melasma. And people call it a pregnancy mask, okay? And it will take a while for things to kind of balance back out. Um, Sometimes melasma, what I've experienced with me and my friends, is not wearing sunscreen, being out in the sun, and it's not sunburn. Sunburn can pass away, and then now you have melasma spots that you need to get the pigmentation back together. Okay. Medications such as birth control, individuals going through pregnancy. You can find melasma on the forehead, cheeks, lips, and your skin could be smooth, your texture could be smooth, but it is the mix up of the coloring pigments, the melanin pigments that's really the cause of the issue. So we would, most of the time, individuals would go to chemical peels because the chemical peel will start to go through those layers of the skin so that new skin can go ahead and come on up. As the new skin comes up, the melasma goes away with the old skin. So that has been the go-to to get rid of melasma, but it's still being researched how you could do it product-wise, or what is the systematic way to do it without our clients having to go through to chemical peels. And if you look at this last sentence here, spots can be healed by exfoliation or can be treated by a cosmetologist. Exfoliation is removal of dead skin cells. There's 3 types of exfoliation: chemical peel. 2, mechanical. You're gonna do extra client. Does she want a derma, not a dermaplane, dermabrasion, mechanical dermabrasion, micro dermabrasion. Okay. Um, And then number 3 is just your regular scrub you would put on the face, and you'll just rub that around um, on the face. And so those are the 3 types of exfoliation. And how you get rid of this, exfoliation is key. I will opt to go straight to the chemical peel in this case, okay, to go ahead and get it done. The microdermabrasion, yes, you remove dead skin cells, but you may have to do a couple of them to get down to where this is. Okay. Nevus, also known as a birthmark or a malformation of the skin due to irregular pigmentation. This again is a melanated issue. It's a melon issue. Or it could be dilated capillaries. So nevus is a birthmark. A stain. A stain can be found just like a nevus in anywhere on the body. Many individuals look at it as when you remove a mole, freckles, or age spots. Okay. And when you think it's age spots, you may also want to look at other areas around the skin. Okay. As we begin to close out, your assignment tonight is to read about hypopigmentation. Um, but put a 1 in the chat if you guys have Netflix. Put a 1 in the chat if you have Netflix. A 1 in the chat if you have Netflix. All right. Look for for a show tonight called Skin Decisions. Okay. Watch an episode for me. I don't care what season. Watch an episode for me and be able to tell me a little bit about the episode tomorrow. It is going to deal with skin issues that have been talking about. And I want you particularly to tell me, how did they fix that? How did they deal with that? Okay. How did they fix it? What did they decide to do? I've watched all of them. So I'll be ready for either one of them tomorrow. But we're also going to pick up on hypopigmentation, and we're going to talk about the rest of the hypopigmentation, lack of melanin issues, and then we'll move into consultations. Okay. Y'all have a blessed and amazing day.